Well, good morning or early afternoon. So this is the last time I get to do this, and I won't go long. But I just want to say, as I look out at you, that's why it's been worth it. I've either had the privilege of being part of the people that trained you or one of the people that you've worked with. And so I just have a few slides, and no one gets called on. For some people, when they talk about their career, they talk about their major research breakthrough, their first New England Journal paper, the first time they chaired an international conference. This is my whole career. There are a few more slides, but this is my whole career. And it's really unfortunate that more people in medicine don't appreciate that if someone doesn't have a DNR or an advanced directive or a post, if you secure the ABCs and consider or give naloxone, glucose, and thiamine when indicated, you could be a great doctor or a great critical care practitioner or a great emergency responder. And you know, regardless of what you believe in your heart, you know 5 causes, 5 steps, 5 reasons is correct. Just suck it up. It's true. Oh, and I also want to apologize. When we had a 4-year program, we had one person that did require an additional year, and it's just that he was able to graduate. No one has done more with less. All kidding aside, it's really interesting. Some of the most problematic interns turned out to be some of the greatest practitioners, leaders, and teachers. You, DeLu, and others. So I just want to make a couple of comments about teaching, because that's what this conference is about. If there is one thing to know as far as teaching, teach less, but teach it better. Because people can't learn that much. And I can't tell you, as someone who's getting close to 100 now, how many lectures, conferences, national conferences I've been to by these greats in medicine, emergency medicine, surgery, and they spew out 6,000 things. I don't remember one damn thing. Teach less, better. And when you're doing it, people don't listen that long, and they can only, in sections, learn 3 to 5 things at a time. Engage them, tell them what you're going to teach them, make them feel the importance of your talk. If you don't believe in how important your talk is, why should anyone else? 3 to 5. And so many of the interns and residents now embarrass me by how great their slides are with pictures and animations. That's what to do. Talk to them, show them some lists, not too many things on it. Show them some pictures that link concepts. You've got to motivate people to learn, tell them why it's important, repeat. So I know that you all are great people, and your mothers and fathers only had to tell you things once. But other people require it 3 to 5 times at least. So try to say what you're going to say it, and repeat it a few times. We teach complicated things. Simplify them. So, this article that I wrote with my professional partner, Dr. Keith Wren, or Wren Sr., talked about 2 sets of 5 or 10 commandments, and it's been updated. So I just want to mention 5 as I close this out. Assume the worst. That is our specialty. As you assume the worst, look for red flags that might confirm it, or look for the absence of them to back you away from the worser things. Hubris sucks. Do not have sinful pride. Some of us make really stupid mistakes. Often. All of us make stupid mistakes. Keep questioning yourself. That's just the way it is. Don't just anchor on one thing. The number of times the greatest doctors have been surprised is a lot. And in the end, always err in a way the patient suffers the least. This is part of why I became good. Because I trained at Grady with no faculty. We saw them, we did them, and then we taught them. And that's how you learn, from your mistakes or your upper-level resident teaching you. I'm embarrassed about how I trained. but that's the old system. Final advice, 2 things. Friends come and go. Enemies only accumulate. You can never take your words back. You can always say them later, and that goes for emails too. Because we had 0 full-time faculty during my entire residency. I had to find mentors, and advice is to find a mentor in your career. But I had Cheech Marin, and what he said about your job and mine, my former job, or when I'm on EMS, is that responsibility is a heavy responsibility. We're the only profession charged with routinely dealing with people's lives, intimacies, their secrets, and saving their lives or allowing them to die with dignity. That's our responsibility. It should be a heavy responsibility. Don't take it for granted. All right, I think the next one is going to be a video. And what I wanted to say was, with the new curriculum and after meeting with the dean a few times, I had to change my teaching tactics. But I want to show you what it used to be like when women were women and men were men, and I knew how to teach better. Go ahead and play that. Please be seated. How many causes of altered mental status are there? A lot. All right. How many causes of altered mental status? 4 causes. Okay. There are 5 causes, 5 steps, 5 reasons for everything. The 2 of you are worthless and weak. Drop down and give me 20. Put a sock in it, boy, or else you'll be out of here quicker than crash through a goose. In the real video, I don't say that. All right, I really appreciate the privilege of having been the founding chair of this department, of having run